welcome you all to the American Academy of Biological Dentistry meeting.
Oh, Chris, could you put the other mic on, please?
I broke it. How's that? That's not, that just takes it out. See if it's still working. Are we still cooking here? How's that? All right? This is on now, right? Okay. Thank you for all coming. We know it's difficult to travel around our country nowadays with the threats that exist out there, so we appreciate you all coming. I drove through a snowstorm with my friend Deborah yesterday from Reno in the mountains at 7,000 or 8,000 feet with 2 or 3 feet of snow. It was interesting coming down here, but California certainly is beautiful. We have an official mascot with us. We got voted in. My dog Rambo, he's with us in back today. Some of you know him already. A couple announcements. We want to have fun this time. We try to have a lot of jokes. I try to crack jokes. Not many of you people laugh at my jokes, but we try to have fun while we're here. Dr. Klinghardt, the gentleman on the left, the distinguished gentleman on the left, looks like Albert Einstein. He and I will be moderating the conference. We want to make a couple announcements. We want to thank, of course, Dr. Arana for starting the group. How long has it been, Ed? 15 years? 15 years? 86 we started. And his lovely bride, Carol, who's running the show. She's running around somewhere in the back. And without her activities and efforts, this wouldn't exist. I always like to take a few minutes here and just say a short prayer to open the meeting for those people that have helped us and gone on to the Maker. One is Norma. That's Carol's sister, who used to be here helping us all the time, and she died several years ago. Along the way, we've lost a couple compatriots. Dr. Terry Allender died a couple years ago, I believe. And I just want to take a few seconds here to say a prayer for those people who have been, those of us who have been persecuted, prosecuted, slapped around by the boards, lost their licenses, all those people that have enough bravery and guts to be heroes in this world today and to do what's the right thing. Let's just bow our heads and just take a minute for prayer. And Lord, please guide us and have a successful conference over the next 2.5 days. Dieter, why don't you come on up? Remember, we're all in this together.
Hey, thanks, Chris. So this was Chris Hassard. For those of you who never met him, the famous. I just wanted to, at the beginning of the conference, to remind you what biological dentistry is for us. Biological dentistry is based on the bold idea that the teeth are connected to the rest of the body. That's really the revolutionary idea that the founders of this academy had, and the minds that were behind that. And a biological dentist is somebody who acknowledges this relationship, meaning that every intervention that's done in the mouth, maybe a filling, crown and bridge work, a splint, work on the jaw, has an effect on all other parts of the body. It's an integrated system where you cannot take one part out without having an effect on all other parts. And in this way, in our view, the biological dentist has to be, to some degree, a neurologist, an immunologist, an internal medicine specialist, a pediatrician, a gynecologist, and an oncologist, and all those other specialties. He has to have some understanding that any work on the teeth will have an effect on all those systems. And vice versa, the even more bold idea is that any oncologist, gynecologist, pediatrician, naturopath, chiropractor, and so forth cannot really succeed in their work unless they work together with a biological dentist. So we've been promoting since many years, since Ed started this academy, the joining of forces that we have all over the world, little SWAT teams that consists out of a biological dentist in the middle and then all those other people around him. And the biological dentists that have studied the material, studied the work, learned from us, and we learned from them, have also one remarkable property, and that is that they all succeeded in business. Because there is a market of patients out there that far exceeds so far the number of people that we have doing this work. And the core pieces of biological dentistry for us are, first of all, we need to have a diagnostic technique to find out what is the particular relationship a tooth or dental problem has to the rest of the body. And there's a number of techniques that have emerged: electroacupuncture, muscle testing, pulse testing, the VAS, those of you who use it, infrared scanning of the body. There's new devices that scan for magnetic field differences, and so forth. And then there's, of course, always the pendulum and the psychics. And without having a diagnostic method that establishes how a tooth is affecting the rest of the body, biological dentistry has been fairly ineffective, because that's been one of the core pieces in it. And with this in mind, I want to introduce the first speaker, who is Andy Landerman. Andy is a dentist in Santa Rosa, California. And he's been one of the oldest guys in the field. He, since 1975, he's been using electrodermal testing to find out what these relationships are and doing his diagnostic work with electroacupuncture. And he started coming over to Germany since 1975 to learn from the originators of this method, which really was Dr. Voll, who was sort of the mind behind it. And secretly, we know that Dr. Voll was a student of Dr. Reich, William Reich, who was put to jail in this country to die here. But Reich was the first one who had an EAV device, and Voll learned it from him. And Voll was a wonderful student of acupuncture and combined German technology with acupuncture, and designed and invented this instrument that can measure energetic relationships. And then Andy has been a teacher of many of us. He's learned from all the good people in Germany. Dr. Joachim Thompson, who is one of the most brilliant dentists ever that we've ever had, who laid out much of the groundwork of what we're doing here. And some of the surgical techniques we're using in dentistry now were designed by Dr. Turk, who's been a teacher of many also. But anyway, Andy has been here in this country, to my knowledge, along with Bill Wolf in Albuquerque, who's also here this weekend, and maybe a handful of others, have been the pioneers in this country to develop electroacupuncture to a very high level and to a very practical level. And so, Andy, why don't you come up here? Andy also, I hear, is making wine on the side. Okay. Andy's giving a... Andy's giving a more in-depth workshop on Saturday night, is tomorrow night? Right. Yeah. On EAV testing. For those of you who are more seriously interested, and then he teaches weekend workshops to learn his work. And Andy is, the top guy that we know of Thanks, Andy.
Thank you. I guess I really can't take exception to this use of the word older dentist, but I'd like to. But thanks, Dietrich, for the kind words. Actually, I used to make wine. Now I'm just a whiner. But also, I'd like to take this opportunity to thank Carol and Ed for providing us such a beautiful retreat that we can count on once a year. I think we much appreciate this surrounding to the casinos and so forth that we experienced last year, and I'd like to give a big hand to them for all of this. This is really a mecca. I don't know if any of you have a chance to get out and around other than maybe go play golf at some of these beautiful golf courses. But I know when I was in school, I used to come down here a lot on the weekends to Big Sur and visit. And one of the real gems that you really can't miss is Point Lobos. It is really a spot to behold. It's out of the way. It's at least it used to be tourist free. And it's one of those points of juxtaposition of land and sea that is just beyond description. So if you get a chance, it's probably 5 minutes from here. It's just south on the coast, and go experience that. It's really a place to meditate by. So anyway, thanks again, Carol and Ed. It's a very, very fine place to come, and it's probably one of the best places in the country for us to come and experience the energy here. Okay, enough of that, and I've been, as Dietrich said, I've been doing this since about 75, and it's the thing that has always made clear to me is that there's no way to fully understand the body, but for me, and everybody has their own way, develops their own way, but for me, the EAV and that kind of approach is about the best I can do. I'm not a psychic as my wife is, but this helps me to see the things, ask the questions and so forth that need to be addressed when we're talking about healing, and that's what we're all here for is healing. If it's not for our patients, it's for ourselves. But I first started out with Vole and Thompson and so forth, and it came over here with Vole doing some lectures here in San Francisco, and then I made the mistake of listening to what he said. He said that 90% of chronic disease comes from the mouth, and I interpreted that to be that that was all amalgams because that's all I knew at the time. And then I dropped everything, thinking that, well, even if 50% of that is true, then I've got a big playground. And so I made a quick exit to Germany and went over there, came back convinced of what he was saying, and began to look at a lot of the literature. And of course, Weston Price had started this out in the early 1900s. And then we look at Fonder's work, and we look at even some of the optometrists got into the act and actually defined that you can reorient the blind spot and in the eye by correcting dental lesions. They started sending people to the dentist, to their oral surgeons, because they could notice when they were doing a technique called sicanometry, which is charting the blind spots, that the blind spots, if they were abnormal, then they made the deduction that there was something else going on in the head, and so it was either sinuses or teeth. They hadn't gotten to the tonsils yet, but there was a definite relationship there. And so they began to exit or to direct people to the dentist and saw remarkable results in visual changes. And I think that all of us that have entered into this work have also seen a lot of visual changes, but their interpretation was that it was all due to infections and interrupting with the pathways of the optic nerve. I think that we can look beyond that now and talk about energetics as being the cause of that, because all of these, the nerves of the head all are modulated through the hypothalamus and on their way to the brain. Now, we've been able to see that these lesions that we can chart in the mouth, we can also chart them in the brain in different aspects. And so there's a great deal of consistency with all of these different modalities looking at the same thing. It's, so as EAV came over here, myself and Dave Eggleston and Von Harada and so forth, we got involved in it. It was kind of like the new toy on the block, but it was something more than that. We all were carrying some sort of a cross because it was a real truth. And as we saw it in those early days, it was something that was going to take over the world. And little did we know there was a little bit of a political conspiracy against it. But Dave Eggleston was the first person to experience that, and he was dragged from his office with handcuffs and so forth after the AMA had sent in a shill to his office, and he took the bait. Blonde-haired, blue-eyed David, you can't believe that he would ever get to the point where he would be dragged kicking and screaming out of his office, but that's the way of the world. But he had his day in court, and the shill that was sent in happened to be one who was suffering from pemphigus. And David set him down in his chair and started going over him, and lo and behold, discovered several things. Well, at that point, the guy was wired, and so they shut him down. But his lawyer aptly pointed out that pemphigus has oral lesions, and the judge duly noted that and said, case dismissed. So he got out of it rather easily, with the exception of spending a night in jail. And myself, I had my trials and tribulations. I just started up practice again in August after all of that, thanks to Charlie Brown. Vaughn, as well, had his trials and tribulations. He was brought up on similar charges of basically practicing outside of the scope of dentistry using EAV and so forth. And I hope you don't mind me telling on you, Vaughn, but he was wise enough to have watched what I went through and not make the same mistakes. They offered him, as they offered me, a suspended license for a period of time, and he said, no way, and was able to fight through that. And again, he was able to point out an inconsistency in the dental regs. They said, well, you're allowed to practice under acupuncture theory if you've been using acupuncture or before a certain date. And so this was pointed out to the judge, and no, I may be a little bit wrong on some things here, but I think that this is the context of it. And when pointed out to the judge asked the prosecution, what about this? Well, I don't know anything about it. And so they, again, dismissed his case. And but these things are what's led up to the current atmosphere in EAV and what's kept people away from it, I believe. Does somebody have a tissue? So there's a lot of controversy around it. I don't think that in any of that controversy exists anything about its validity, and that's what, thanks. That's what I think is the important thing that we have to discuss here today is validity of it and its honesty, its integrity, its ability to be used adequately and dependably in the mouth and elsewhere. So let's see. The beauty of EAV is that it's basically like an electrical engineer's device to see if there's current flow. So it's one of the simplest devices to use there is, and it can tie into any circuitry that we have. Now, the history of it goes back to, as Dietrich pointed out, Voll's discovery in terms of acupuncture, that we can observe these meridians, observe current flow through these meridians, and then pose certain questions to the body vis-a-vis these devices by imposing our energetic questions vis-a-vis homeopathic solutions, and then the body will give us answers back. Is this appropriate? Is this acceptable? Yes, no, maybe. And so we can proceed through all of the different systems in the body within a very, very short period of time and come up with very profound answers as to what is appropriate, as to what is the blockages in the pathways, and that's probably the key most central issue in any pathology. What is the blockage in the pathway? And so therein lies the statement that 90% of chronic disease comes from the mouth, because most of the things that are done in the mouth are blockages, or can represent blockages, or sedative properties to the pathways, or hyper influences on the pathways. And so either you're going to speed up the energy, slow it down, or stop it by anything that we do in the mouth, i.e. root canals, restorations, gold, silver, and so forth. And this is what is very easily demonstrable by using these devices. And as I say, if a seasoned practitioner sits somebody down, within 5 minutes you can come up with a relatively good assessment of what is at the basis of the problems that they're dealing with. Now, the things that we come up with time and time again are, of course, amalgams. I don't happen to believe that this is the single most devastating thing that has happened to mankind. I think that probably the root canals and dead teeth are far and away much more devastating on a systemic basis to amalgams. But amalgams set the body up for the devastation caused by these other problems. And then the other things that we see, of course, is the cavitational problems. Now, the cavitational problems are a result of a couple of different things. One is, of course, improper extractions of dead teeth, of root canals, of whatever, of wisdom teeth, etc. Now, we can see these both in X-rays as well as with EAV. We can pick them up very rapidly. Now, the other cause is an impedance in energetic flow in these areas at the point of extraction. Now, and that can be caused by things like amalgams in the mouth prior to the extractions or during extractions, gold restorations in the mouth, or my old friend Lymes. Lymes is, I know Chris has brought this up for a long time, and I've also been doggedly on the trail of this bug for probably 8 or 10 years myself, as I was the recipient of one of these spirochetes from ticks probably 25 years ago. But so it was a real impetus toward my figuring out this illness. But the way that amalgam, of course, enters into the picture is that it greatly impedes the lymphatic circulation, and so that any time that we do anything in the mouth, we have to have lymphatic circulation. If we're going to do any kind of surgical intervention at all, we have to have that. And I think Voll demonstrated years ago that in a cross-section through a vascular bundle, if you look at the lymph vessel is 9 times out of 10 just shut down like that. Now, upon removal of amalgam, the lymph vessel then becomes patent. And so that it was a clear demonstration of the efficacy of triage, or not triage, but cleaning up the garbage can, emptying the garbage can before you do your surgery. And so the other aspects, my feeling is that gold does the same thing. Now, about 7 years ago, I spoke with this group. I believe it was in 1994 down in Puerto Vallarta. I don't know if any of you were there at the time, but I mentioned the fact that gold was not an acceptable restorative material, and I got a lot of moans and groans at that point in time. I think that there's a growing cadre of people that now agree with that. But it can be just as devastating as amalgam. Now, one of the things that we see, that we're able to see with EAV that you don't see with, say, chemical analysis of blood and so forth, is that amalgam, if we look at the toxic effects of amalgam, many times the most toxic aspect of amalgam is silver. And if you look at the successes that people have had with removing amalgam with people with MS and seeing almost instantaneous results of some of these people getting up out of the chair and walking when they came in a wheelchair, that's a silver effect. And you can look at that through EAV prior to doing the removal and know that that's going to happen. Mercury does not work that way. Mercury is a toxic effect. It's not an energetic effect. And mercury, when you remove amalgam, you have to also remove the mercury out of the body before you get your effect. And the silver is not absorbed and does not act in the same way as the mercury does. Now, I've talked to Haley about this, Boyd Haley, and his answer is that, well, maybe, but we just don't have, we're not given the money. That's not where the romance is, so we don't get the money to do the research on this silver. So, we just don't know. But again, you can see this from looking through EAV that in fact is what's happening. You see lesser effects from the other metals in amalgam, but those two are the deadly sisters there. And but so if you're looking at a patient, you can almost predict what their reaction is going to be to the removal if you are looking at those two metals and seeing how the body reacts to those two metals. Now, if we look at, if we go to gold, we can look at that through EAV again and see that gold is comprised of gold, platinum, palladium, silver, and some others. Now, the ones of concern, of course, are the ones that are the highest presence in the material, and gold being the highest. If we look at the homeopathic provings of gold, what is it? Gold is the homeopathic remedy most indicated in the most deepest, severest depressions. The other thing that gold is used for homeopathically, or was used for, was the treatment of syphilis. One of the qualities of syphilis was its ability to cause bony cavitations. And we see, people with mouths full of gold, and we see the same people with mouths full of bony cavities. I don't think so. The other thing that we see with amalgam is that the mercury was used for a long time for the same purpose, and that was to cure syphilis, homeopathically. And so it has also, in its rubric, most of these people that come in that are chronically ill in our dental practices, when they Am I saying the syphilis causes the bony cavitations or the treatment causes the bony cavitations? Well, as I said, in gold, in its provings, causes a syphilitic-like picture. So in its provings means if you have that substance in excess in your body, in other words, gross substance, then it will cause this picture that the provings show. And the provings are the picture that is presented that in a homeopathic dilution, in a person with this picture, the homeopathy will cure that picture. So it will cure the picture of syphilis. Syphilis causes, or syphilitic miasms will cause the cavitations. Okay? These other things in gross form can cause these cavitations. Homeopathic treatment by these will ameliorate this picture. Okay? Answer the question? All right. Any other questions? Yes, sir.
Yesterday I heard a physician present about colloidal silver, how wonderful it is. Do you disagree with that, with this silver problem?
Yes and no. I think that everybody is individual. The beauty of EAV is that you can measure that individuality and check to see, number one, which person can handle it, and number two, which product that person can handle. I think colloidal silver has been used, for about 400 years to treat bacterial entities, and it it came into vogue around the time of the plague, and that's where the saying he was born with a silver spoon in his mouth comes from. And so it's a very valid way of working, but you have to know who you're working with and so forth. Okay, so the point is that with EAV, this allows us to be very selective in terms of what we're dealing with, how we're looking at it, and how to approach it. Now, the other thing is that we're looking at a modern-day scourge here, and I want to concur in every way with Chris Husser, because he's been a bloodhound on a trail for a long time, and that Lymes is that scourge. Lymes is a dead ringer for syphilis. It just doesn't have the social onus that syphilis brought along with it. Although nowadays I think that it probably should have the same reputation, because it probably is just as transmissible by sexual means as syphilis is. It is identical in all ways, and it probably creates about the same kind of pathologies. Now, what does that mean in terms of dentally? Well, we're looking again at probably bony cavitations as being a possible result of presence of Borrelia. Now, there's no proof of that as far as I'm concerned at this point in time, but let me give you a little different scenario than, say, a Western medical viewpoint, and that is that even if it's not found in these bony cavitations, does not mean it's the culprit, because if we look at Chinese medicine or Ayurvedic medicine, we can see that these lesions are not necessarily a cause of a direct cause and effect. In other words, they're not necessarily caused by something that is directly associated with the lesion, i.e. An extraction, inappropriate extraction of a tooth by leaving in membranes and cortical bone and so forth. That's not necessarily the cause of it. Now, as Bucco points out and others have pointed out, these lesions, when put to the test of the microscope, show little or no circulation. Well, that, if we look further into Chinese medicine and Ayurvedic medicine, that would imply that there's some organ deficiencies. Okay, so if we look at the principal organs that would cause that kind of a problem, we would be looking at the kidney, which represents bone, and the liver, which represents circulation, as well as the heart. And if we look at the organs that we see that are in the poorest condition with somebody with chronic Lymes, these are the principal organs, along with the brain. Now, in Ayurveda, we look at the brain and the bone marrow as being the same tissue. So that when we see that these lesions are at the level of the bone marrow, then we can count on the fact that these lesions are also occurring in the brain. Now, what is one of the hallmarks of chronic Lymes? Memory loss, mental fatigue, disorientation, etc. These are all central nervous system dysfunction areas. And so if we look at this disease from a broader perspective, this disease being cavitations, I'm switching horses here, but if we look at cavitations from a broader perspective and not under the view of a Western microscope, then we begin to understand how just by taking care of the cavitations does not necessarily deal with the problem. And so that when we do cavitational surgery, even though it may be indicated by EAV, by kinesiology, whatever other means we're looking at, this does not solve the problem because we have to deal with these organs. Now, in dealing with the organs, we have to deal with the Lymes. There's no question about that. I've dealt with it from a naturopathic standpoint in terms of herbs, in terms of lifestyle changes, etc. These are only cursory. These are only short-term results. And whereas you get people feeling better, but once you stop the herbs, then the symptoms return rather quickly. Or the other thing is that they get refractory and the herbs are no longer effective. And you have to keep changing your regimen. Now, once you have rendered the bacteria helpless or eliminated it, then the whole picture turns around immediately. Herbs that were effective for the organ dysfunctions you were looking at from an Eastern standpoint no longer are useful, absolutely useless, in fact. The picture changes so much that the person will react to those herbs that 2 days ago they were totally therapeutic to them. So, but until we deal with that one central bug, the whole picture is one of maintenance. You have to maintain all the time. Once you begin to deal with that bug, then you can begin to become rejuvenative in your approach. Bill?
Step about how to eliminate the bug.
Okay, we'll get to that. I think eliminating the bug is probably, there's a lot of different kinds of approaches, but I will give my approach. It was rather interesting to me to see, to monitor hourly, sometimes daily, and otherwise myself and others, because once you begin to focus on this bug, you see how prevalent it is. And that all of the sick people, all of the chronically sick people that you have it. I mean, it's incredible. And all of their syndromes center around this bug. And so until you focus in on that syndrome will not basically change. Okay. All right, and so the one of the things that I began to look at when I saw this the presence of Borrelia was I began to see patterns. And of course, every pathogen has its patterns, whether it's a flu virus, influenza virus, whether it's a Coxsackie virus, whether it's a strep pneumonia or whatever it is. They all have their patterns. They present with different kinds of mucus, different colors of mucus, different characteristics to the mucus, different parts of the body that they affect, and so forth. You know, the flus will affect the lungs, and the colds will affect the heads, and so forth, and so on. And this spirochete has some very interesting patterns to it that are very important for dentists to recognize because they do affect very specifically the oral cavity in a way that is devastating to the rest of the body. And it's hard for me to know at this point because I've only recognized these patterns about 2 or 3 years. And but when it comes to the mouth, the first thing when I go through and do an oral exam, I note the teeth that are showing up as being non-vital. And if the spirochete has been there, if it's what I would consider late stage, then the first thing you're going to recognize is that for some coincidental reason, there's 4 first molars that are dead. And this is about as consistent as you can find any kind of a bacterial reaction to be in the body. Now, these will not necessarily have endodontics done or anything, even restorations in them. But these teeth will be beyond repair, dead. And so, it's a very, very hard call because here you are many times looking at a virgin tooth, first molar. And that tooth is staring you dead in the face, and it is non-vital. Now, it may not be showing up by electrical tests and so forth, but with EAV, you can check the meridians, you can check the tooth, you can check it always from front to back, and that tooth is still going to test dead. And
This is what Borrelia now you're saying?
Borrelia, yes.
Which meridian is that?
Well, they are, the upper is the spleen, pancreas, stomach, and the lower is going to be the lung, large intestine. Okay, there are other things that are affected by those meridians, but those are the basics. Yes?
Are you saying that electrical pulp testers will not show a dead tooth?
Not necessarily.
EAV will show it.
Absolutely.
So you'll get a pulpal response, but the tooth is dead.
That's correct. You may get a varied pulpal response. It may not be, it would be, say, in the questionable area, or, well, within variable limits. But it's going to show a variation from normal.
How about ice?
Ice, again, the same thing. It won't be what you would get on the second molar. But obviously, there's no first molar to check it against. So you'd have to go to a second molar to get a comparable reading.
So there is live pulpal tissue there.
Yes.
And how is it not alive?
Well, energetically, something is it's like a computer. It's either yes or no. Either you're with me or you're against me. And this is the this is the fallacy of a lot of these endodontic treatments that people say are rendering the tooth okay. Now, a tooth that is treated endodontically, for most of us that use these kinds of modalities, will just shake their head and walk away. It just ain't so. It can't be so. Because something that is abnormal in the body, either you can correct it back to vitality, or you better forget it. Because if you're checking on that meridian will never be whole until or unless that tooth is gone. Bad news. Yes?
Patty, could it be possibly that these 4 teeth tie directly into the gastrodigestive system? Could it be that the gastrodigestive system is completely diminished energetically, reflecting or refracting to the teeth, and the teeth are also devitalized? The whole gastrodigestive system can be so depressed by antibiotics, by whatever therapies that go on, etc., over a long period of time. That's, you're talking about the first permanent teeth that come in, the primary molars are the first teeth coming about 6 years of age. So could this be a condition of a degeneration that starts at a very early age on this person, making it susceptible? And you're measuring actually energetics of the whole system, not just the tooth.
Well, I think if that were the case, then you can revitalize the whole GI tract by using herbs, by using probiotics. There are many modalities with which you can revitalize the digestive tract. And if that were the case, you could do that. But in doing that, in subjecting the GI tract to some of these herbs that I favor, you either get limited response, or you get basically an allergic response to these herbs. And probiotics and hydrochloric acid and so forth are, again, maintenance. They do not revitalize. The body does not have the capacity to revitalize when you have dead teeth in that meridian. Okay? So, but if the GI tract was the primary cause, then you could reverse that. And then you would get reversal of the teeth. But that's not the way it works.
There was a naturopath that found out that children that were not breastfed the first 12 hours of delivery would not produce, become achlorhydric in the stomach parietal system of hydrochloric acid reduction. Everybody said the stage for chronic illness to occur later on in life. And the thing they say too is there's a peripathic bacteria, periodontal disease, that's a spirochete of Dr. Paul Tye's work where you look at the microscope. Is Borrelia visible then under a microscope?
Yes, it is.
So what you're saying is that this spirochete that's associated with periodontal disease or bone loss could be the one in the same or similar energetically spirochete that you're talking about in Borrelia, and that may have exposed that person?
Certainly similar, but I mean, understand that all spirochetes cause damage.
Right.
And this particular one is causing a panoply of things that we're beginning to see as, creates a whole pattern of things throughout the body, as syphilis does. But we don't see syphilis that much anymore, so this one is taking its place. This is possible that another spirochete laid the groundwork. But as far as the gut being the main cause, from what I'm seeing, I don't think that's the case. Yes, sir.
I get ratings from one of the very, very best EAV operators in the world. Sends me a chart that says I need to do a cavitation surgery on an upper third molar area. The same patient has at least 2 other root canals, maybe a couple of other amalgams that test clear. Does that happen?
Well, you may be looking at layering. And I'm not sure that, I really can't comment unless I saw that person sitting down in front of me and came up with the same conclusion. Because I've seen too many root canals that were supposedly done by this technique, that technique, by great operators, etc. And when put to the real test, they don't show good.
Well, I'm not talking about the operator on the root canal.
That's what I'm talking about too. Doug?
Yeah, one thing I've seen in those cases, which is this idea of layering or of amount of stress. If the body has a high amount of vitality, it can have a root canal tooth and handle it because it has a strength. You're like if you're carrying a 200-pound pack on your back and you're strong and healthy, you can deal with it, but it's a load. And there's a point where vitality comes down, or there's one particular area that is a priority right now. The body says, if you get rid of this, I'll be very happy. And then once this one area is taken care of, then things change. The body says, oh, by the way, I have another problem here. And that can show up later that was a problem. And it could even be that it's so overwhelming the body isn't even trying to deal with it at first, but it can try to deal with this one. So we can't take one test and say that tells the whole thing. From experience, we need to check, deal with what the body says is the problem, reevaluate and see if other things crop up. It's possible to induce extra stress to the body to bring latent areas to the surface, whether it's by electrical stimulating or tapping on the tooth or tapping on the brain, and then you can see latent areas that may not show up initially, but even some of those may be masked until you remove other issues, and then the unmasking lets you see underlying regulation conditions.
Yeah, I absolutely concur. I think that there are ways to look at these things, and there are ways to look at them, and it just all is in the hands or in the eyes of the beholder. The person who's really well seasoned at it will have a whole different picture than somebody who just hasn't had the experience.
So would you say that every root canal tooth should be extracted?
Well, I would say that every root canal tooth is a possible time bomb, and you have to explain that to the person that has them. That, as Doug said, we all have different constitutions. Now in Ayurveda, you're looking at the typical tridoshic theory, the Kapha, Pitta, and Vata constitutions. And if you look at the Kapha constitution, the pure Kapha constitution, you're looking at somebody that is, a little bit rounder, a little bit more jovial, a little bit more sedate in their ways. But the one thing that Kapha has is it has healing energy. And so if we look at somebody that has an ample amount of Kapha energy, they can probably sustain 2, 3, 4, 5 root canals in their mouth without a problem for a period of time. Now there comes a stage in your life where that Kapha energy begins to wane and you go more toward the Vata side. Now the Vata constitution is a constitution that is somebody that's usually taller, thinner, hyper energy, and does a lot of things to the detriment of their health. The more activity they have, the better they feel, but the more activity they have, the sicker they get. And 80% of illness is in the Vata side of the equation. Now, everybody has combinations of these things. And depending on our lifestyles, we have more Kapha energy. If we're more sedate, we like, where the Joe Sixpack likes to sit on the couch and watch football on Sunday. We're going to develop Kapha energy. And if we're out, running marathons every day of the week, 365, then we're going to develop a lot of Vata energy, no matter how much Kapha we got. We're burning our bridges, so to speak. And the more of the Vata that we accumulate, the sicker we get. Now, if you take somebody that is naturally a pure Vata and you do even one root canal, you can just throw them clear out in left field. But if you take somebody that's pure Kapha and you do 3 or 4 root canals, they may be able to sustain that. So when I'm looking at somebody and evaluating what to tell them, I'm going to base my clinical judgment on what I'm seeing before me. There are a lot of other ways to judge this kind of energy, in terms of their activity levels, in terms of their, lifestyles and in terms of their mental attitudes and things like this. And this, I know my wife sitting back there will address this tomorrow. But it's a very, very important tool as far as I'm concerned in terms of using judgment to make these kinds of decisions or help people to make these kinds of decisions. Yes, ma'am.
The pittas run in the middle of the road then?
Pardon?
The pittas, they're going to be in the middle of the road?
Yeah, pittas in the middle of the road. More, you know, the typical politician is a pitta. You know, they have very direct energy, very, you know, their kind of their mantra is just give me the punchline. Don't worry me with all the facts. That's not important. And you know, they're usually of one mind, and once they set their mind to it, they will accomplish it. And you know, the Vata is kind of all over the board. They've got a lot of things going, but you know, they unless they learn to focus in their life, that's their biggest challenge. And the Pitta's biggest challenge is to focus, but to control his ego or her ego. And because many times they'll use that to try to accomplish the things that they're getting into, and that's their pathology. And the Pitta is their pathology is in their liver. It's to control their anger is their challenge in life. And so when you're evaluating these things, you know, you see a sick Pitta, and you really better beware, because they can really hurt you, because that anger is right on the surface all the time. And you can identify this many times by looking at the person, evaluating them, and also by, you know, what's your principal emotion? What do you mean? You know, and I mean, they'll let you know right away. And you really have to be very, very careful with these people and let them know exactly what things are about, how you're going to address it, and what the outcome is. And you better be right, because that's what they expect. Okay? So, let's see. Now, in terms of the significance of these dead teeth, I think that we, again, have to go back to the Constitution that we're looking at. Now, I think I've chosen a little demonstration here. I thought I'd have Dietrich come up here with Bill Glaros, and we'd go through a couple of things here. Dietrich, my briefcase is right behind you there. Yeah. Bill, could you come up? Yeah. Okay, now I'm going to have Bill sit here and have Dietrich do some muscle testing, which really gives us the same information as EAV. And it just depends on, you know, how you choose to go as to, you know, what's your favorite. So, Bill, Dietrich, would you go ahead and check Bill's molars, please? And without provocation. Maybe call off the molars as you check them. We haven't pre-rehearsed this at all, so.
So he has a sign for me that he has an active focus somewhere, and I need to find first before proceeding.
Okay.
Do you have any acute situation?
Yeah, but no worries.
So he's got an active something going on in the hip. Let's see if it's Lyme disease. You got it here.
So he's got a homeopathic remedy for Borrelia here, and that's testing positive.
For the hip joint, that he's got some living Borrelia in the hip.
Now,
Andy, you checked me a month ago?
yeah, we checked about 3 weeks ago, and this is what we came up with. But the point to understand is that what meridian passes over the hip governs the hip. That's the gallbladder, which is the liver, basically. So, okay, go ahead.
So he's a politician.
Well, you can also see, Pitta energy has this this male pattern baldness, and we see that in
So the first molars?
check, yes.
The first molar. Okay. No.
No, there's already risen here. Check the site. That's missing there.
Okay, so he has 2 extractions already on the molars. They're not testing in the more superficial way of testing, and then the left lower, which is still in place, is testing. The right upper first molar. Oh, we were testing the first molars on him. Yes, already 2 that are extracted. The right lower and the left upper are already gone. And the left lower is testing positive, that there's some kind of distress on it. And the right upper is not testing when I test like in a simple superficial way like this.
Okay, you want to provoke those areas? I mean, now go to the second molars, because it will go from the first molars to the second molars.
So we get the right upper second molar is testing this way.
Now have him hold that and test his second molar. Now test the other one. Now you want to...
So they're both testing positive for a connection with Borrelia. Now this is a test that Andy showed me 10 years, that was in Puerto Vallarta.
Yeah.
It's been such an incredible test. By provoking the teeth, by tapping on them, often teeth light up that you didn't see before. Let me do it on a healthy tooth.
Take the Borrelia away.
I'll go to the
15.
Now this testing, it's also sounding funny. Yeah, when I tap that tooth, it sounds hollow. It doesn't sound like a solid stone. It sounds like something made out of porcelain and that's hollow inside. So there's a different sound to it. So you can tell from the pitch after a while of doing this already.
And is there any restoration in that tooth, Bill?
Probably a composite filling.
It's as I recall, it's a very small composite. And so this basically demonstrates what I'm talking about, in that you see not only the first molars, but the first molars are gone, and but it's going to the second molars. Now, what do you do about this? Well, this guy's healthy, wealthy, and wise. Am I going to get in there and stir up the nest? Well, I'm going to leave that to him. I'm going to describe what the situation is and tell him the long-term prognosis, and then it's his decision. Now, once before I recognized this pattern, about 3 or 4 years ago, I told him that he had number 30 was dead, and he looked at me unbelieving, and he had, just recently taken an X-ray of it, and he ran home to his office. Shortly thereafter, took another X-ray, and there was the tooth was internal resorption, so the tooth was gone in a very short period of probably 3 months that he'd taken his last X-ray. So, so anyway, just thanks for the demonstration. And
Just wanted to say one last thing. Like, if he was in my practice, I look at him, and if he's healthy now, I just tell him, I would turn to him very quietly and say, listen, like, if you have those teeth extracted, your hair's going to grow back. And your penis is going to get twice as big as and this is how I sort of charm the patients into
thank. Hey, that's why I have a full denture, you know. He told me that, and he's a liar.
That's why you have your hair.
Yeah. Yeah. Come to think of it, I was bald before. It's true. Okay. Now, let's see. Is there any questions so far?
Do you have any pictures of the EAV for the newcomers?
You know, I don't, and I was counting on Doug to be here with his all of his paraphernalia for next door, but he foxed us all, and he decided to be a spectator this time. So I do have my my apparatus in the room, but I didn't bring it along, and so I'm sorry I don't have it here for us. But actually, I could certainly at some point maybe set it up in the next room, and we could all, whoever wants to come by and look at it and see how it works and so forth. Also, I'm giving a short course tomorrow evening after the course. Lee?
Don't you find that a lot of patients with Borrelia have syphilitic miasm underlying that?
Generally, yes, but as I was, I looked at that very hard and long for a long period of time because I thought, well, I can't be looking at Borrelia all the time. Like 7, 8 years ago, I was thinking, my God, this can't be. And so I thought, oh, maybe I'm seeing syphilis instead. But, I checked syphilis. No, it just wasn't there. And so in terms of the miasm itself, sometimes it's there, sometimes it's not. It's just yes and no. Yeah.
And is there a way to arrest the Borrelia to stop its destruction?
Yes, there is. Now, question, is there a way to arrest the Borrelia to stop the destruction? Well, that's the $64,000 question. And can you stop the teeth? Can you reverse the teeth? Can you change the cavitational lesions in the mouth without addressing the Borrelia? No, you can't. Can you address the Borrelia without addressing the dead teeth and the cavitations? No, you can't. So you have to devise your approach to deal with both entities at the same time. So I use the Stoffen Pharma remedies. I use herbs, and I will begin to implement therapy from that standpoint about 2 weeks before I will do the surgery. And when you do that, you're loading the cannon, so to speak, so that when you do provide the surgery, then your results is rather quick and forthcoming. Okay?
I got all my hair.
Okay. All right. Yeah, but is it real?
Yes, it's real.
Okay. Chet?
What is the test for Lyme disease?
Well, the conventional tests, I think Lee Cowden could probably give you a lot more on that, or Chris could. But there are blood tests for it, and they're notoriously inaccurate. And this is why Lyme's disease is not seen as the scourge that it is because they are unable to correlate it with anything consistently. Because if you only have a 30% accuracy on your blood tests, then if you present 100 people with chronic fatigue to blood tests for Lymes, and you only see 20 or 30 of them show up with positive, then there's no correlation there.
So what do you test? How do you test?
I use EAV. Okay. Yes, sir.
Have you found certain herbs to be commonly effective? What are your favorite herbs?
Well, my favorite herb for very specific for Lymes is teasel. It's an herb that grows here in California. It grows quite a bit across the country, I believe. It's an import from Australia. It came in on the backs of the sheep. Actually, it was brought in as the head of it is very spiny, and it was brought in for cleaning wool. This was before they had the wool cleaners and combs and so forth. But so this was a brush to clean wool, and it's got a taproot that goes down about a foot to 18 inches, and it's the root that is effective. And I make a tincture of that, and it's a very, very, very powerful herb and very specific for Lymes. If a person does not have Lymes, it doesn't do them a bit of good. In fact, it will actually go the other way. But it rejuvenates the kidneys, it rebuilds the liver, etc. It does wonders, but it is not totally curative. Yes, sir.
What's the general dose and frequency and duration of teasel?
And the name?
Teasle. And the Latin name is dia something. Sorry, I can't give you that one. But the dose I measure out, and it goes anywhere from 2 to 5 drops 3 times a day of the tincture. Yes, ma'am. Yes, I do.
With alcohol
In alcohol. Brandy.
For how long are they on it?
Well, until I also use other herbs quite extensively, and I use homeopathy, and so they're on it until the Lymes is gone.
You got months or weeks? Or
Months.
what other herbs?
Let's see. Well, first of all, we have to look at the organs that are depleted. And so I'll go into the liver first of all. And I'll use something called Bringraj, which is an Indian herb, Ayurvedic herb, Bringrag. Buplorum, which is a Chinese herb, Beupleurum, I believe it is. And I know that I'm going to be doing some bony surgery, so I'm going to use comfrey root powder, dandelion root powder. These are all powders. Teasel is the only tincture. And then another Indian herb called Gokshura, Gokshura. And gravel root. Gokshura is actually commonly called goat's head, or what's the common name is? Oh, it's one that grows along the ground. You can't drive over it because it'll puncture vine. It grows in hot, desolate places. Then we like to use licorice root. Others for the GI tract, along with licorice root, would be slippery elm. Slippery elm powder, but you have to be careful about slippery elm because it's on the verge of extinction, so you want to make sure that it's not wild-crafted.
It's not wild-crafted?
Yes.
What does that mean?
Wild-crafted means that there are people that make their living going out collecting wild herbs, turning them over to herb people and so forth to be processed. And golden seal and slippery elm are two of the western herbs that are really in danger, as well as American ginseng in danger of extinction because of that practice. Yes, sir? And not for this, no. Golden seal is a very cold herb, and it tends to deplete over long-term use, and so I limit its use to other things.
Are there any herbs that can eliminate cavitations naturally?
No, not that I've found. I found some that measure up well energetically, but they don't hold up well over time.
How do you use the powders?
Pardon me?
How do you use the powders?
How do I use them? I will mix them all together, and then have them take a teaspoon of it 3 times a day on an empty stomach in water or juice. Now there's some other interlopers here on the scene, and ones that are generally found running along with this bad guy is a couple of other bad guys, and that is the hepatitis group of viruses. And so depending on what you find there or don't find, you may not find them on the first go-round, but again, on layering, they will come to the surface quick. And your patients are going to come in sometimes awful pissed at you because they're feeling this or that, but it's inappropriate. And so you understand that the liver's coming to the surface. And so then you check right away for the hepatitises and get them on some liver herbs that like milk thistle. I don't like to use the silymarin powder or anything like that. I like to use a straight seeds, ground up seeds that I grind so they're fresh. That helps regenerate the liver. Now, they may not be able to take this if you aren't at the same time using both Teasel and the homeopathic remedies. Okay? Now, don't send these people off for blood tests expecting to find all of these entities, because you won't. These things are bound up in the tissues and they're not in the blood. Okay? Now, the Lymes, for those of you who haven't really done a lot of work on it, have to understand that this is a very elusive bacteria, and it is very wise bacteria, very successful, in that it coats itself with a protein that makes it invisible to us. It also exists within the cells and within the bone, within the brains, and these are all very inaccessible areas to the body, and this is why even long-term use of antibiotics, from what I understand, really don't do it. Because, again, antibiotics don't attain high enough levels in the bone or the brain and in the cells themselves. So the body has to wait until they come out of the cells in order to replicate that they are then accessible to antibiotics. Yes, Terry?
Has any ripe technology been used to try to do domestic burden?
I've had people that go to Rife practitioners and they come back.
Unchanged.
Yeah,
So the answer is no.
that would be my assessment. They may have some successes I don't know about. Dietrich, do you have any?
We haven't seen any successes with it. Robert Lyme.
How about ozone? The Germans are going to use ozone to effectively knock down the spark.
Again, Dietrich probably would know more about that.
Yeah, ozone definitely works, but doesn't eliminate it. It slows it down.
And what I can say about the homeopathic treatment of it is that many times it takes 2 to 3 times around, but each time you see a lessening of the symptoms, and it takes a longer time to come back. And when it does come back, it's nowhere near as virulent as it was the first or the second time. Okay. All right, so as I said earlier, I'm going to have a demonstration. Or yes? Oh, 5 minutes. Well, I'm just about there. So I'm going to have a program Saturday evening for those of you who would like to begin to get a picture into how to use the Computron, which is the device that I use. It's one that Doug Lieber puts out, and I think it's an excellent device. I think that these things are, first and foremost, they're programs, and he's got an excellent program. And then they're pretty much all the same after that. There are some bells and whistles on many of them, but once you understand the machine, understand how it works and so forth, you can do pretty much anything you want within your own mind. It's all up to you as far as how creative you want to get or can get in terms of using them. I think that some of the others I've seen have some deficiencies in terms of what they show, what they're able to show, and I think that just the product that Doug puts out is about as good as I've seen in terms of, I mean, you're only going to get so good at one of these devices. There's, it's basically an ohm meter, and that's what you're looking for, and then the program. And beyond that, it's all up to the operator. Now, the other thing that I wanted to add into this is the use of the Cavitat. I've got onto that last September, and I really was kind of befuddled by it at first, but as I've used it more and more, it's really become part and parcel of my whole practice. I wouldn't want to exist without it at this point in time, because what it does, what the Computron does energetically, this does physically. This actually shows you the actual lesions of the cavitations, and it basically portrays them in a way that you can't see in X-rays. It's just impossible. And it took me a while to learn how to use it and get my confidence in it, but it's something I don't want to be without. So I think that Bob Jones is here somewhere, and he's got his own devices, so you might pay him a visit and look at that device as well. So those are really the two things that I think are essential for my way of practice. So without any further ado, you have any questions? Yes, Bob.
I just have a comment for those interested in the overall picture. As we all know, the primary vector for Lyme's disease is the deer tick. And the new issue of the Audubon magazine has a really incredible article written by Ted Williams on the ecological disaster of the overrun of white-tailed deer. And when you read that article and its relationship to the increased incidence of Lyme's disease, and after you read that article, you may find yourself a lot kinder to the local hunting community. In the process of eliminating all the coyotes and the wolves and the bears, we have an ecological disaster of the overrun of white-tailed deer. So, and they're also, because they're unhealthy, because they're destroying their own ecosystem, they're being limited by deer tick infestation, which is creating a problem with us too.
Lee.
I found a test from Boeing Research Laboratory in Florida that is a pretty good blood test. It misses the diagnosis of Lyme compared to etiology or EAV maybe 20% of the time at most. So it's a lot better than most other things out there. It's a fluorescent headlight stain specimen looked at under dark field microscopy. You're looking at actually Borrelia organisms and fresh white cells that have just come out of the bone marrow.
Great.
I'll give a phone number if you want it.
Yeah. Can you maybe write that up here? Yes, ma'am.
Is a homeopath preventative enough? Like, I have like dozens of deer in my yard.
Well, I would say that it probably is for a period of time, maybe 3 to 4 months, but beyond that, no.
As a preventative?
Yeah. I don't know that they really have anything that is. Now, one other comment about to what Bob was saying, you know, I heard also another possibility as far as the spread of Lyme's disease, why it's so prevalent now versus, say, 100 years ago, and that is that the killing off of the band-tailed pigeons. Now, the band-tailed pigeon used to run in flocks of millions, and the band-tailed pigeons were grain eaters, and so that with the elimination of that, the grains that were out there available to the deer mice became astronomical. So the populations of the deer mouse, which is the intermediary host of the deer tick, their feed supply went way up, and so did their populations. And so they were able to spread the deer tick, etc. So, you know, there's lots of theories, and I'm sure that probably all of them are true to some degree or another. All right. Any other questions? Yes, sir.
Hey, Dad, I just want to put a plug in for the enzyme protease. Whenever you're dealing with any organism that has a protein sheet on the Lyme disease, to just rouleau in the blood. Had great success using protease as a metabolic enzyme, not as
Right, right.
digestive enzyme.
Yes, I understand. Bill, is it?
Bill.
Yeah. He's talking about using proteases, enzyme proteases, and these are, I think, gaining a lot of favor across the board, the enzymes in general for controlling fungi and bacteria, because the fungi also, Candida, they're using that now for dissolving the cell layer on that one as well. So, yes.
Just one more comment. In the old days, we knew that, you mentioned it, that syphilis was treated with mercury. And what we're observing is when we got very enthusiastic about mercury detox maybe 10, 15 years ago, and I realized that many of the people that we detoxed started going downhill. And that was because we took the antidote to the Lyme disease away from them. You know, by taking the mercury out, the Lyme disease started becoming more symptomatic. So we unmasked that. And so, however, you cannot treat Lyme disease without getting the mercury out as well, because mercury perpetuates the illness and allows it to exist in the body. And so, I just want to plug in that to eliminate Lyme disease or any of the chronic infections, we have to address the metals. And when we address the metals, we have to be aware that the infection may grow out of control, and then we have to address those as well. So most of us in the inner circle of this group are very aware of that you cannot do metal detox without addressing the infections, and you cannot address infections without doing the metal detox that belong together.
Yeah, remember what was said earlier, that the elimination of the amalgams from the mouth, it's not only that, but the amalgams will cause a lack of patency of the lymph vessels. This is what Dietrich is talking about. You have to have lymphatic flow to heal. So if you don't remove the metals, you don't get that lymphatic flow. Okay? Thank you very much.
Let me just do a couple caveats here. Please don't go run home and start diagnosing your patients with Lyme disease with a dentist. The boards are looking at everybody. That's all you need to go home and say, you have Lyme disease to a patient. The patient goes to the boards to make a complaint. You're practicing medicine without a license. Please be careful. I warn you, because I'm having some trouble myself, and I can do anything I want, but I'm still having trouble. You got to be careful. I warn you. You see this on everybody. What Amy told you was right. I can't find patients that don't have Lyme disease. And when I do kinesiology and do the Bowen test, it's 100% accurate for me, 100%. Now, I've showed you slides of teeth with Lyme disease on them. So you can take samples if you want to and send it to her. Dr. Whitaker will do the samples for you. Send some tissue and stuff. If you call them, they'll send you a test kit. This is an epidemic disease. Now, Andy, I'm going to make a correction here. These critters aren't coated with proteins. They have no cell walls. And Dr. Nicholson will talk about this, I think, and you have in the past. This is the theory of infectious diseases, that these bugs become cell wall deficient and the immune system can't see them anymore. So one of our jobs is to make the immune system, to wake it up and make this thing visible to the immune system. And that's how some of the oxidative therapies work. The ozones and the EAVs, the ozones and peroxides and hyperbarics, and maybe some of the homeopathic medications do help that. That's what we need to do, is to make this bug more visible to the system. This is the next pandemic disease. It's here already. And those of us that are treating it, especially on the East Coast, the boards are going after, the MDs are trying to take their licenses away for treating Lyme's disease. Dr. Barascano, who has written therapies on how to do that. I use some of his work. They're trying to take his license away. And doctors who treat this on the East Coast are very surreptitious about how they treat this because they're after us for doing the right thing. The CDC says this isn't a problem. This is spooky.
What else is new?
What else is new? Dr. Nicholson is on at 11 o'clock, so we'll take a half-hour break. Don't miss the next lecture.
Anything was good.